20 years ago, in an extraordinary act of global solidarity and leadership, the world created the Global Fund to fight what were then the deadliest pandemics: HIV and AIDS, tuberculosis, and malaria. Since then, working hand in hand with communities, governments, the private sector, civil society and our technical partners, the Global Fund Partnership has helped save over 44 million lives. These are not just numbers. They are parents and children, teachers and workers, neighbors and friends. Since 2002, we have cut the combined death rate from the three diseases by more than half. The AIDS-related death rate has fallen by 74%. The TB death rate has fallen by 42%. And the malaria death rate has fallen by 47%. Countries have entirely eliminated this dreadful disease that primarily kills young children and pregnant women. And thanks to the huge progress made, people are living longer, especially in low and middle-income countries where the diseases are most prevalent. Take Malawi, for example. In 2002, a person in Malawi could expect to live to just 46 years. In 2019, the life expectancy had increased to 65 years, an increase of 19 years. More than 2/3 of that remarkable increase is because fewer people are dying from AIDS, TB, and malaria. But in 2022, the world is confronted with unprecedented health challenges. COVID-19 has had a devastating impact on the fight against HIV, TB, and malaria. For the first time in 2 decades, we have seen declines in programmatic results across all three diseases. HIV testing fell by 22% in 2020 compared to 2019, and prevention services by 11%. 1 million fewer people were treated for TB, with the treatment of drug-resistant cases falling by 37%. Malaria deaths rose by more than 12%. That means a child is dying of malaria nearly every minute. But it could have been much worse. Early scenarios predicted that deaths from AIDS, TB, and malaria could increase by 60% over a 12-month period due to severe COVID-19 related disruptions. But thanks to a rapid response from the Global Fund Partnership, donors, countries, and communities, we averted roughly 1.5 million deaths. The Global Fund played a critical role in helping countries and communities respond to the pandemic and mitigate the impact on life-saving HIV, TB, and malaria programs. With the support of generous donors, our COVID-19 response mechanism, C19RM, has now committed more than $4.3 billion across 109 countries and 22 multi-country programs. To get back on track against HIV, TB, and malaria, to build stronger systems for health, better able to protect people from pathogens, old and new, and to implement our ambitious new strategy. The Global Fund needs significant resources. A successful Seventh Replenishment means we can save 20 million lives. To achieve that goal, we must raise at least $18 billion in this replenishment. With at least $18 billion, we can accelerate progress against HIV, TB, and malaria, and build resilient and sustainable systems for health that can help the world prepare for future pandemics. This scale of investment is essential. We either increase funding to fight the three diseases, or we abandon our global commitment of defeating HIV, TB, and malaria by 2030. We risk surrendering the gains we've collectively fought so hard and invested so much to achieve. In fighting diseases as formidable as HIV, TB, and malaria, there is no middle ground. We are either winning or losing. Every dollar invested in fighting HIV, TB, and malaria through the Global Fund yields an extraordinary $31 in health gains and economic returns. Investing in global health is one of the best investments the world can make. We could avert more than 450 million infections or cases of HIV, TB, and malaria between 2024 and 2026, reducing the incidence rate by 58%. We would also be turbocharging the strengthening of formal and community health systems, better able to fight the diseases killing people now, better able to prevent, detect, and respond to new threats. And in a world that seems ever more divided and unequal, we would be helping to reduce the sharp inequities in health services and outcomes by redoubling our efforts to tackle gender-related and human rights-related barriers to access. By putting people and communities at the center, we will help to build more inclusive systems for health that leave no one behind. It can be done, and if not us, who? And if not now, when? This is our fight. Join us to fight for what counts.